All right, it is 3 o'clock. I am going to get us started. It is my pleasure to welcome you to the first Illinois Bone and Joint Institute virtual adult education series program with the North Suburban YMCA. I'm Karen Brownlee, adult program coordinator with the Y, and I am happy that you have joined us today. This collaborative effort was originally created to bring you a monthly lunch and learn series at the Y in Northbrook, and we had our first program last month, but things have changed. Fortunately, we are lucky enough to be working with a group of doctors and professionals at Illinois Bone and Joint Institute who were willing to swiftly transform their program to us to offer us this virtual platform. Therefore, I am proud to say thank you to Dr. Eric Chehab, IBJI Orthopedic Surgeon with Fellowship Training in Sports Medicine and Shoulder, who will be presenting information about how to handle orthopedic and musculoskeletal injuries during COVID-19. Dr. Chehab has received all 5-star reviews on Google, and the comments revered his bedside manner, his attention to detail, and his ability to listen and explain complex information to patients. I am certain that he will handle the explanation of how to receive care during these challenging times with the same thoroughness and thoughtfulness. A number of people submitted questions to us prior to this program, which I'm sure that Dr. Chehab will cover. But if you have a question for him during the presentation, you can type it in the chat box. If you have called in, he will hopefully have time to tackle questions at the end, and I thank you for your patience as he may answer them along the way. Please be advised that this is our first virtual program together, so we are learning, along with you, how to make all of this work. So thank you in advance for your patience if we come across any glitches in the ether. Now, with no further ado, I present to you Dr. Eric Chehab of Illinois Bone and Joint Institute. Dr. Chehab?
Karen, thank you very much. I hope everyone can hear me well. Welcome to our webinar on how to handle injuries during COVID-19. I'm going to just share my screen, and that'll allow me to put up some slides that I've created. So, and the slides will be helpful for us as we go through the webinar. So let me pull this up. And can you see my screen, Karen, Nick?
Yes.
Great. Okay, good. So, and Karen, thanks so much for hosting this. So obviously this is something none of us have ever encountered before. I don't think, and I hope we never do see anything like this ever again. But the COVID-19 pandemic has changed our lives from every single way we can possibly imagine. And injuries are still happening despite the pandemic. And so I'm hoping that I can help people on the webinar understand how they can address these injuries and what they can do in the setting of this pandemic. So just so that everyone's aware, I have no conflicts of interest to disclose in this talk. I have no financial interest, obviously. So COVID-19, what is it? Well, COVID-19 is actually the disease. That's the name of the disease, and it stands for CO for corona, VI for virus, and D disease, and 19 being the year that this emerged in late 2019. The disease is caused by this virus. The virus is SARS-CoV-2, and SARS stands for Severe Acute Respiratory Syndrome. It's a SARS virus, and we've had a prior SARS outbreak in 2003, and that was SARS-CoV virus. It did not have a number attached to it because it was the first one. This virus is very contagious, and for some it's potentially deadly. The pandemic is, that's a term we use when there's a worldwide outbreak. An epidemic is a term that we use when there's an outbreak that's within a city or a state or a country, it's within a community. Pandemic is what we say when this virus or a disease is spread worldwide. Now, novel, we've heard the term, this is a novel virus, and the term novel simply means it's never been seen by humans before. So this is our immune systems have never seen this type of this virus in particular before, and that's part of the reason why people have been susceptible to falling ill. We think it may have originated in bats. It may have originated in China. This is not uncommon, by the way. There are many coronaviruses that exist in animals. There are hundreds and hundreds of viruses. And there are 4 different subtypes of viruses that exist within animals: alpha, beta, delta, gamma. But there are only 7 known human coronaviruses. 4 of which are quite common and cause very mild illnesses, such as the common cold. And then there are 3 that are less common but tend to cause more severe illnesses. MERS is the Middle Eastern Respiratory Syndrome virus, and that emerged in 2013 in the Saudi Arabian Peninsula. And then there's the SARS-CoV virus, which was the original SARS outbreak in 2003, and our current outbreak, the COVID-19 disease caused by the SARS-CoV-2 virus. And you could think of COVID-19, SARS-CoV-2, one being the disease, being the virus, similar to the nomenclature we use for AIDS and HIV. AIDS is the name of the disease, and HIV is the name of the virus. The symptoms that are caused by the coronavirus and the symptoms that people have when they have the disease of COVID-19 are generally, these are the big ones: fever, cough, and shortness of breath. And the symptoms can appear 2 to 14 days after exposure. So if you somehow become in contact with the virus and it infects you, you may or may not know it for 2 to 14 days. And there are many people who just never know it at all because they're asymptomatic with the virus. But there are people who certainly know it, and some people get very, very ill as a result of the virus. Now, the symptoms beyond cough and shortness of breath and fever, other ones include chills or repeating shaking with chills, muscle pains, headache, sore throat, and very interestingly, the loss of taste or smell. So the diagnosis of the disease of COVID-19 is based on these symptoms in the presence of having the coronavirus. Now, this is a disease that's spread through respiratory droplets. It's a very highly contagious virus, and part of it is because it's a hardy virus. It tends to just survive well in respiratory droplets. And these respiratory droplets get expelled by one person with the virus. It can be either inhaled by somebody else, the droplets, or if they land on surfaces and you touch those surfaces and then you touch your nose and your mouth and your eyes. Those are the common forms of disease transmission. That's why we so emphasize hand washing with this condition, because if you have those respiratory droplets on your hands and then you touch your face, that's how most viruses actually enter the body. Most respiratory viruses enter the body by a virus being on your hands that then you touch your mouth or your nose and your eyes. And I remember my first year in medical school, our infectious disease professor telling us this, and none of us believe how much we touch our face, but if you just sit around and watch, it's amazing how frequently people touch their face. And so that's an advantage that the virus has for us. So we can stop the spread of the germs by avoiding close contact. This is the social distancing that we are doing. And we can also cover our own coughs or sneezes in the event that we are carrying the virus. We do want to avoid touching our face to avoid the transmission that I was just discussing. And we want to clean and disinfect these surfaces. The CDC has a very robust website, and I've included the address here, that really goes through so many ways on how to protect yourself and what to do if you've become ill. So the website has been absolutely a godsend for all of us in guiding us on what we can do that's safe and effective for keeping ourselves safe. Face masks, wearing face masks now is what's required in many public places, and the face masks don't protect us from getting the illness, but they protect our neighbors from ourselves. So if I'm wearing a face mask, a cloth face mask in particular, then I'm actually doing a favor for my neighbors. I'm protecting them from me in the event that I am asymptomatically a carrier of the virus. It's very important to stay home when you're sick, because if you are sick and it's possible that you'd be sick from the virus, you don't want to transmit it during that time while you're symptomatic. And then finally, wash your hands. And in fact, when you wash your hands, it requires about 20 seconds of hand washing for it to be effective. Now, I visited the CDC website, and they have so many resources there. It's amazing, including on how to make a cloth face mask from scratch. And this is the one I made out of a pillowcase that I just hand sewed and used some rubber bands on the edges for my ears. And it took about 10 minutes and very simple to do. And so again, the cdc.gov website is a tremendous resource for all of us. Now, those who are at risk for having a severe illness are patients who have lung disease or heart disease. We have friends and family who might be immunocompromised. obesity is now an established risk factor for having a more severe illness if you have the coronavirus. And elderly patients are more at risk. Patients who suffer from diabetes are more at risk, and patients who suffer from liver and kidney disease are more at risk. Now, it's interesting. We talk about how the virus is affecting countries differently. It's actually not the virus that's different within the countries. It's the host of the virus. And here in the United States, we have an obesity epidemic. So we have many patients who suffer from obesity in the U.S., and that may explain why we are having younger people who are getting more severely ill than in other countries, or our rate of diabetes might be different, or kidney disease might be different. So again, the virus is the same from one place to the next, it appears. It's just how it behaves is somewhat dependent on the host of the virus. And while these people are considered at higher risk, these are our vulnerable population, any one of us can actually develop a serious illness. Now, the majority of us, the overwhelming majority of us, will not. But the fact that it can potentially give us a serious illness is what makes this such a tricky problem to address. And we've all seen this at this point of our time in the pandemic, this idea of flattening out the curve, that if we did not take any protective measures, we'd have a lot of cases in a very short period of time, and the number of cases would outpace what we'd be able to treat in the healthcare system. And this nearly happened in New York. It definitely happened in Italy. And the doctors in Italy were making these heart-wrenching decisions on who should live and who should die based on their lack of full medical capacity. So it appears that here in Illinois and in New York and in other places around the country that we've successfully flattened the curve. We've distributed these cases below the level of our healthcare system. But remember, we haven't solved the problem. The virus is still out there. We don't have a vaccine at the moment, and we don't have any effective treatments that we know of, despite all the proclamations. The studies have not verified that any of these treatments have been helpful yet. And so what we're really doing is pushing the date down the road. We're making it that if we are to get infected, it's a later date. But there are advantages to that. And when we look at if we come up with a therapy where this green line is, if we come up with a vaccine, then we've spared so many people of being infected with the virus itself compared to if we just let it go. And, the more time we have, the more we can learn about the virus and how it behaves. And so the more we can come up with ways of at least protecting ourselves and protecting our family members and treating some of the complications that may occur when someone is more severely ill. So time has been a benefit. The time has really allowed us to learn a lot more about how we can treat patients who are infected with the virus. Now, testing, boy, we hear a lot about testing. And testing requires, and I kind of get this from Schoolhouse Rock, people, places, and things. It requires a lot of nouns. Testing requires people, personnel, to actually to do the tests. And you have to set up sites like these drive-through sites as places where you can do the site testing conveniently. And it requires lots of things. You need this personal protective equipment to protect the people who are giving the test. You need these very long, skinny swabs to be able to collect a specimen that will be diagnostic. And these swabs and these personal protective equipment are not in infinite supply. In fact, they're in very short supply. And that's been one of the reasons why the testing has been slow to be rolled out. In addition, the tests themselves, the kits, reagents, the solutions that these tests and these swabs are dumped in order to be able to come up with an answer of do you have the virus or do you not? These are also in relatively short supply. So we've been caught a little bit flat-footed with regards to testing. It would be wonderful if we had an infinite number of tests that everyone, before they walk out the door, can test themselves. And, oh gosh, I have the virus, I better stay inside and then protect my neighbor. So because we don't have a lot of tests, we are protecting our neighbors by sheltering in place. Now, there are two types of tests that I think are important to know about. There's the testing with the swab, and this is the quote-unquote PCR test. And what this question is answering is, are you carrying the virus? Do you actively have the virus? And you can see in this animation, it's a long, skinny swab that has to go way deep in the nose. So it's actually a very uncomfortable test. And because it's uncomfortable and because it's prone to sampling, some people just can't get the swab far enough up their nose to get a sufficient sample. So there have been some imperfections with the test just in terms of sampling error. So in other words, someone might be carrying the virus, but because they can't get the swab deep enough into the nasal cavity, they don't get a good sample and they test negative for virus. Another type of testing that is emerging is called antibody testing, and this is where your blood gets tested. So either a small blood sample or a draw of blood like you might have at the lab. This blood is then used to see if you have antibodies in the blood. And the question this test is answering is, have you already had the virus? Now, if you've already had the virus and if you have antibodies, then that should confer some immunity. This has not been confirmed, but it certainly makes a lot of sense that if you have antibodies, it should confer some immunity. And in fact, patients that we know who have already been infected and who have recovered, being asked to donate their blood. And they're being asked to donate their blood because their blood is full of antibodies that might help someone else fight the disease when that blood is transfused. So if I, for instance, have had the virus and I've recovered, I can give my blood, which should be filled with antibodies that might be useful for somebody else who is very, very sick. Now, I'm going to digress a little bit, and this might seem a little bit off topic, but again, we keep hearing about tests and not having sufficient tests, and we also hear about not having good enough tests or adequate tests. And so I kind of want to go through this little exercise of just looking at some numbers. Now, again, if we're looking at the antibody test, there were some studies done out in California that seem to suggest that about 2% of the population has been exposed to this without really knowing it, and they would be antibody positive. And then the other 98% has not been exposed, and they would be antibody negative. And so when we look at that 2%, 20 out of 1,000 would be 2%. Now, the perfect test has no false negatives. So in other words, if you have the antibody, you should test positive all the time, and no false positives. In other words, if you don't have the antibody, you should be negative all the time. And that's a perfect test and 100% reliable, whether you test positive or you test negative. Now, that test rarely exists for any condition whatsoever. And so most of these tests have a very small false positive or false negative rate. So when we look at that false negative rate, for instance, for the current antibody testing, it's about 80% accurate that you won't get a false negative. About 20% of patients who take a test will have a false negative result. And so that means about 4 out of 20 will test negative even though they have antibodies. And it's actually, when you aren't antibody negative, these tests are very good at not giving you a false positive in general, about 99% good at that. So if you have a population of 980 people, about 1% of them will have a false positive rate. Now, if you fill in the rest of the chart with the numbers, the number of people who have antibodies is 20, the number of people who don't who has 980, but the number of people who have tested positive, when you look at the results of this, when you have a positive test, there's really just a 62% chance when you take a population that they actually have antibodies. And so that's kind of a funny thing with the numbers. And that's part of the reason why we can't rely on the tests for antibodies at the moment, because we don't really know what to do with the result. It's not that much different than a coin flip. But as the disease progresses, let's say 10% of the population has been exposed and has antibodies, and that would leave 90% who hasn't. And if we take the same test that has 20% false negative rates and 1% false positive rates, then the numbers become much more favorable in terms of the results of the test. We can make much more sense of it. So this is one of the funny things about testing that we're currently dealing with, is that because the disease isn't that prevalent in areas, we don't know how to interpret a positive test. But with time, we will. So even with the existing tests that are imperfect, they will become better and better simply as the population becomes exposed. So where can you find a lot of this information? On the CDC website. And this is the homepage. If you go to cdc.gov, you can click on coronavirus or any of these other tabs, and you will have a tremendous set of resources at your disposal. Now, what do you do if you're injured? Because with injury, you by definition cannot practice social distancing. You need someone's help. And yet people are very frightened of infection. They're afraid of the facilities that they would go to. And so just to give sort of some general advice, you will never go wrong with the RICE mnemonic, RICE, with resting, icing, compressing, and elevating. So RICE, each letter stands for something. Rest, ice, compress, elevate. This can help any injury as an initial form of treatment. You can even make a splint. And I think towels make wonderful splints because they're soft, but if you wrap them up enough, they're stiff enough to give you some support. So for instance, this painful elbow could be splinted with a towel and a little bit of tape, or likewise with the ankle, or likewise with the forearm or a wrist. What I'm afraid is happening is a lot of people are using this as their strategy. Don't see the doctor. And that's exactly what we don't want to promote. You should see the doctor if you have an injury that's more severe than what can be treated with rest, ice, compression, and elevation. Now, this is a patient that I took care of who basically fell at home on a Monday, did not see me until Friday. And he has this terrible broken wrist. And so this poor gentleman is 86 years old. He didn't want to go to a healthcare facility. His daughter didn't want to go to a healthcare facility. And by the time they arrived at one, the arm was so swollen, so bruised, totally not useful, that it just made for a more difficult problem to solve. And again, the facilities, everybody's taking all the precautions that we can possibly take to keep people safe. So please don't make a bad problem worse by neglect. And so what are your options if you sustain an injury? Well, your options include going to the emergency room. We have an Ortho access clinic, which is a walk-in clinic where we evaluate injuries same day. You can certainly call and make an appointment with your doctor. And telehealth has been emerging as another means of being able to touch base with your doctor to get an evaluation so that these injuries aren't being ignored and not being made worse by neglect. Now, let's look at ortho access and the doctor's appointment. So if you're coming into one of the offices, I can tell you that our offices are following all of the CDC guidelines. We do temperature checks of everybody who walks through the door. That includes patients and staff. We're asking screening questions of, have you been ill? Do you have a cough? Have you had any travel? And so these screening questions are also very helpful at making sure that we're keeping our facilities as safe as possible. We have people going around frequently disinfecting high-touch surfaces. And so we have, again, the CDC has its resources where you can learn how to make your own disinfectant. And it's incredibly easy. It's 4 teaspoons of bleach in a quart of water. That's it. It's very simple. And that bleach in of itself is toxic and kills the virus. Do not ingest it, though, as some people have suggested. That would be an incredibly bad idea. So, in fact, I think it was such bad advice that most people thought it was so stupid that they couldn't follow. But do not ingest it, but certainly use it as a spray, wipe down surfaces. Universal masking is a way that we are protecting our patients and protecting our staff. Everybody's wearing a mask. And again, it's not helping the person wearing the mask protect them from the disease, but it's helping someone catch it from them. But if everybody is masking, then we're all protecting one another. And then finally, frequent hand washing, hand sanitizer. We have it all over the place. My nurse and I joke that our office smells like a swimming pool because there's so much bleach, so much hand washing, so much sanitizer going around. So these are safe places. In fact, when you compare our offices where you would be evaluated for an injury to the grocery store, it's like night and day. And then telehealth. Telehealth is a very, very interesting way of evaluating patients. It's obviously emerged very quickly. Many people who are on the call and had questions in advance were asking questions about telehealth. Telehealth is defined by the U.S. Department of Health and Human Services as the use of electronic information and telecommunications technologies to support and promote long-distance clinical healthcare, patient professional health-related education, public health, and health administration. Technologies include video conferencing, just like we're doing now, the internet, store and forward imaging, streaming, and terrestrial and wireless communication. So, in other words, any sort of electronic form of communication. Now, FaceTime, which many people have in their iPhone, could have been used for telehealth in the past, but it wasn't compliant. But many of these rules have been waived to allow patients and physicians better access to one another so we can evaluate these injuries and conditions in the setting of a pandemic. Now, telehealth was not available in all states. In fact, this is from 2019, just in the beginning of the year. All the blue states are the ones that allow it. The non-blue states have not had laws in place. Now, with the pandemic, every state is blue. There's been acceleration of the adaptation of telehealth, both from a legal standpoint, from an insurance standpoint, and then from a physician-patient standpoint. I've done hundreds of telehealth visits this last month, and all the years prior that I've been in practice, I've done 0. And this has happened because of this virus. This virus has accelerated everything from the insurance standpoint for telehealth, and it's accelerated everything from a patient standpoint, a physician standpoint. And when telehealth was being adopted just a month ago, our algorithms were quite simple because not all the insurance carriers had gotten on board at that time. But this is our current algorithm, much more complex, much more involved with all of the insurance carriers. So just in a month, the rapid adaptation of telehealth has been dramatic. There are certain benefits of telehealth that are just terrific in a setting of a pandemic like we have. Number one, it opens up access to people who may not be able to come to the doctor. And certainly through telehealth, you're practicing social distancing. You are not face-to-face. It decreases your risk exposure. And it's very convenient. You simply need your computer, and basically that's about it. However, there are some drawbacks of telehealth, and one is that the physical exam is typically limited. We can have people move, we can see things, but we can't touch and we can't test strength. And there's certain injuries that just become very evident by touch and by testing strength. And so we deprive ourselves as physicians of that type of exam information. Likewise, a simple x-ray obviously can't be done by your computer screen. And so we again, working with a little bit less information when we're using telehealth as a primary means of evaluation. And what it translates into is that physicians, when they are evaluating patients, are relying more heavily on the patient's story. So we really need to pay attention to the history and get all the details from the history that we can. And we're relying a lot less on the physical exam and tests. Now, fortunately, there are many conditions that can be made, many diagnoses that can be made of conditions based on the history alone. But certainly, there are bits of information that we cannot gather through telehealth. Now, the nuts and bolts of a telehealth visit, when you think about it, are not dissimilar when you're making an appointment with your physician. And it's basically an agreement to meet at a given time. And our telehealth, we actually just have you call our office to schedule the appointment. And just like you would if you were in person, you would do this for the telehealth visits. You are then invited to a waiting room, and the waiting room is essentially a web address. Some telehealth platforms will have you download an app. The one we use does not. We have constant, unique web pages for each physician. But that web page is the same for each physician, no matter how many visits. When you do go to the waiting room, you'll be asked to enable your camera and your microphone, just like you have for this meeting. And then when both sides are ready, the exam begins. And so I've taken a couple of screenshots just to try and show you what it looks like from the doctor side and what it looks like from the patient side. So from the doctor side, this is what my waiting room looks like. And I can invite people by email or by calendar invite or by a text to their cell phone or by printing something and mailing it. And what it is, this is my website. This is what gets sent out. And so when I invite someone, I invite them to my website. Now we have to agree upon a time ahead of time, but that's what gets sent out. What patients receive, for instance, if we do it via text, is this. Hi, this is Dr. Eric Chehab. Join me for a secure video meeting. And this is my address. So this is like coming to my office, just you're doing it on the World Wide Web as opposed to physically coming to the office. Now, when you click on that blue link, you'll end up at this page. And on this page, welcome, check in to let Dr. Chehab know that you're here, just like you do when you come to the physician's office. When you check in at the receptionist, you let them know that you're here so that both the doctor knows that you're here and you know that the doctor's there. And so you type in your name, I put in patient 0, and then you press check in. And when you do that, you'll be directed to this page that says, hey, can you enable your camera? And then once you do, there will be a warning light that comes up that says allow or don't allow. So clearly you would allow your camera to be enabled. And then you'll be in the waiting room. And in the waiting room, I have, a picture of me. I have some information about me. I haven't put up magazines yet, but I suppose I could do that. But you can be in this virtual waiting room and you can gather some information before your visit. And what am I seeing on my end? Well, on my end, once you check into the waiting room, I see that you're there. And all I have to do is click on this. What's really great about some of this technology is that we can have a visit with more than one person. So if you want to come to a visit and you want to invite your husband or your family member, they can log in from a separate site and we can dial them in. So you can have more than one person in on a single visit, just like you can when you go to the actual physical doctor's office. And so that's really as simple as it can get, and that's what we have. It is important that you have a good internet connection. So Wi-Fi typically works much better than cellular, but a Wi-Fi connection is preferred, and that you have some reasonably up-to-date software. And if you have a camera enabled on your phone or on your computer, and you have a microphone enabled on your phone or your computer, then you have everything that you need. Now, I want to bring up an example. This is a patient of mine, JS, who was wrestling with his teenage sons. And Mr. JS injured his arm. He felt something tear a little bit. And he's a little bit sore. He wasn't sure what was going on. So he scheduled a telehealth appointment with me. And he told me this story. And then I had him do a few maneuvers in front of the camera. And what I saw was this, where he had a lot of bruising here on his arm. And this bruising is very characteristic of a chest injury to his pectoralis. And so based on his history, and based on this limited physical exam that I can do through the computer, I suspected that he had pectoralis tear. And so when we did an MRI, we could see that he had a tear of his pectoralis. This black line here belongs over here. So this black strip belongs over here. And the muscle had torn and pulled that black strip back. So that was the injury. And so we were able to diagnose his injury and confirm it without him ever having to come into the office. And then we decided on treatment, and I don't want to get into his treatment, but that's basically what we were able to do through telehealth. So we made, everything you could do in person. Here's a different patient, WB. And WB is a younger guy who suffers from Parkinsons, actually. And so a young man with Parkinsons, he's able to manage Parkinson's exceptionally well through exercise. And he was exercising. He was playing basketball. Again, practicing social distancing, doing everything right, but he injured his leg, and he ended up coming to the office, and it was very clear on his physical exam that he had what's called the quadriceps tendon rupture, that he tore the muscle in the front of his thigh that inserts into the kneecap. And when that happens, patients have a very, very difficult time walking. They have a very difficult time straightening their leg, and they could become incredibly weak. And so we ordered an MRI, and it confirms that the muscle tendon had torn from the bone. This black, thick right here, that's the muscle tendon, and it's torn away from the bone. So WB ended up having surgery for his injury because if he didn't, it would really affect his ability to walk over the long term. He'd be weak, his leg would be giving way, and he'd be having trouble straightening his leg. So injuries, what are we seeing in the COVID-19 pandemic? Well, I call these confinement injuries. You have kids that are living on top of each other. Wrestling is going on, like our patient JS. And so we're seeing injuries to fingers and wrists and shoulders and ankles and, kind of all the things that we typically see. Things have not gone to zero for certain. We are seeing less of the high energy trauma. We're not seeing near the number of pelvic and femur fractures simply because there are fewer cars on the road and fewer car accidents. We're not seeing ACL injuries because there are fewer people playing sports. And so there has been change in the type of injuries that we're seeing. Fortunately, the majority of the injuries that we are seeing can be treated with simple splints or casts or braces and or physical therapy. And our physical therapy offices are much like our regular offices. Our regular offices have the ability for telehealth, and likewise, the physical therapy is also doing telehealth. So they have spread out their appointments. They have reduced the number of therapists to allow people appropriate space in the therapy office, and they're doing a lot more telehealth visits to guide people in their recovery through physical therapy. Now, surgery. When are we doing surgery during the COVID-19 pandemic? Well, up to this point, we've been reserving surgery only for injuries that pose a threat to someone's life or to their limb or critical function of that limb. If that injury meets that criteria, again, it's very safe. Everybody's masked. Everybody, the personnel and the patients have been screened for COVID, and it's a safe environment if, God forbid, an injury requires surgery. And the surgeries that are being performed tend to be for broken and crooked bones, or for tendons that are torn, for WB, or for patients who are suffering an intractable pain. They just simply can't go on. Elective surgery, I view this as kind of a misnomer, and this is a news report that my father-in-law and I were interviewed about. My father-in-law was scheduled for surgery at the end of March, but it was postponed due to the pandemic. And elective surgery seems to indicate that, boy, the surgery isn't needed or it's cosmetic. But in fact, elective surgery to us in the medical community simply means it's non-urgent surgery, that you have the luxury to elect what time you do it. So patients and surgeons can choose a time that's convenient to treat their necessary problem with a necessary procedure. And so I'm hoping over time, this term elective surgery gets replaced with non-urgent surgery because it's a much more accurate description. The reason why we've postponed it is for preservation of PPE. And the PPE is a personal protective equipment. And in surgery, we use a heck of a lot of it. We use a lot of masks and gowns and gloves. And so we stopped doing elective surgery to allow us to catch with the personal protective equipment that was needed for testing and that was needed for caring for patients who became sick and ill with COVID-19. Now, these elective surgeries, by definition, are not a threat to life, limb, or critical function, so they wait. But we do have patients waiting in pain, waiting with conditions that they've been looking forward to treating for a long time. So if you want to learn a little bit more about that, you can visit our website, which I think the IBJI website, or the ABC News Chicago website, and take a look at the story. Now, prevention. An ounce of prevention is worth a pound of cure always. And I know this is going to sound so trite, but the bottom line is, please don't get injured. This is not the time to get injured if you can avoid it. Again, on our Facebook page for Illinois Bone and Joint, several of our physicians have posted short video clips on how you can avoid injury. And it's a great resource, and it's certainly worth looking at. If I were going to make my own summary of how to avoid injury, the first is try to avoid the confinement injuries. And many times it's just getting outside. People feel frustrated. They feel tight. They just feel overcrowded. And it's safe to walk outside. You put on your mask. You keep your distance between people. You get some fresh air. And that's one great way of avoiding the injuries of confinement that have been happening. One thing I've been seeing is that I have a lot of patients who've been coming in or telehealth recently with injuries from trying things. I wanted to jog. I haven't jogged in years. Or I started lifting weights. And what I think is happening is that they're just taking a bigger bite than they can chew. So we've seen patients presenting with knee injuries and knee swelling or shoulder injuries or tendon tears because they were very ambitious about their picking up a new habit. And so again, during this pandemic, if you are going to pick up a new habit, take it very slowly, start slowly. And if you were going to have me choose what exercise you should do, I would just tell you to go for a walk. And walking is wonderful exercise for your cardiovascular system. It's wonderful exercise for stress relief. It's great for building bone health. I rarely see people injured walking. And if you want to make it more challenging, if you're used to sweating and things like this, well, you can certainly put a little bit of weight in a backpack, or you can just walk a little bit farther. So I love walking as a pandemic exercise, as a way to avoid injuries compared to all the other choices that you may have. And then along these lines, at Illinois Bone and Joint, we've had this Ortho Health program ongoing since 2017. And the main thrust of the Ortho Health program is to help people manage musculoskeletal pain and injuries through better weight management and better health management. And health and weight management are intimately related to how well you sleep, how well you manage your stress, how good your diet is, and how safely you exercise. And so, those are really the four big things that can keep people healthy when there isn't a pandemic. And they're certainly equally, if not more important, in the setting of a pandemic. Get good sleep, manage your stress. If you're going to develop new habits, stress management would be a wonderful one. Eat well. There's a tendency when we're confined and in this shutdown to eat unhealthily, to grab the potato chips and maybe have an extra drink with dinner. But please, instead of doing that, pamper yourself, eat well, and then exercise safely. And again, I can't emphasize how walking fits that. And so these are principles that we've had in our Ortho Health program that I think really specifically apply in the setting of a pandemic to help prevent injury. And so in summary, I mean, this is really what I wanted to cover. If you're injured, seek evaluation. Yes, you can start out with the RICE mnemonic: rest, ice, compress, elevate. Yes, you can use a makeshift splint if you need one. But please don't be shy about reaching out. Use the telehealth or use the Ortho Access. Make an appointment with your doctor. Even go to the ER if you have to. Again, we want to keep you in the safest environment that we can. It's important to follow CDC guidelines to keep safe. So wash your hands, socially distance, use face covering. What the CDC is recommending is helping keep you and your neighbors safe. And again, it's that cdc.gov website is a tremendous resource. And prevent injuries. Again, preventing injuries may be a matter of just choice. Again, if you're going to try something new, don't go too crazy on it at first. Or maybe just, again, resort to walking as your main form of exercise because it's just so good for you. And you're unlikely to ever get injured walking. And then take care of yourself. Eat well, sleep well, manage your stress well, exercise safely, spoil yourself a little bit. That's what you need to do in a pandemic to alleviate some stress. And then finally, again, sleep well, stress, eat well, exercise safely. We can't emphasize this enough. So that's my presentation. I wanted to open it up for questions that can be done through the chat box. I'm going to turn it back over to our organizers for the chat box. So let me, I'm going to take a look at, I'm going to see if I can stop sharing my screen here. Okay. So I haven't had a chance to review the chat box.
So there is a question. Hi, it's Karen again.
Hi, Karen.
There's a question that isn't necessarily directly related to you. That is, what are the early symptoms of COVID-19 that my elderly parents should watch out for? And would a pulse oximeter be of any use? Is that a question you can answer?
I again, it's a little bit outside my area of expertise, but the symptoms that elderly patients get are seemingly very similar to what anybody can get, but it's fever, cough, and difficulty breathing. Those are the big ones. And then loss of taste and smell, chills, muscle aches, headaches. Any two of those 4 or 5 symptoms can be indicative of a COVID infection. Now, a pulse oximeter is useful for at-home monitoring because even though patients may have some difficulty breathing, the pulse oximeter can let them know that they're getting enough oxygen into their blood. And when that starts lowering from the 90% where it's normal into the 80% where it's abnormal, that tends to be the moment when people need to come in for support. What has been puzzling and difficult about the COVID-19 disease is that many patients, by the time they present to the hospital, have oxygen saturations that are lower than any of us have ever seen. And so there are people presenting with oxygen saturations in the 70s and 60s. And up to this point in our medical experience, when people had oxygen saturations that low, they were confused, their mind didn't work normally, they were very lethargic. Yet the COVID-19 patients seem to be lucid and able to talk and not particularly confused, but struggling breathing. So there's something going on here that we really don't understand. But most people will tell you that if you have a diagnosis of COVID-19 and you're at home, that a pulse oximeter can be useful in monitoring that your saturations stay up. And as long as they stay up and you're breathing reasonably, then you should get through it without having to go to the hospital. If your saturations start dropping into the 80s, and they normally aren't in the 80s, if they're normally in the 90s and now they're in the 80s, then that's the time that patients should seek care. So that's about that's the limit of my knowledge on that as an orthopedic surgeon. But I hope that's helpful.
I think it is, for sure. Another question would be, how do people find out if telemedicine is covered by their insurance companies? I know you had the slide with people's insurance companies that were listed. Should they call their insurance company to find out?
So it's never good to assume, right? There's that old expression about when you assume. But in general, every insurer has embraced telehealth and has followed the lead of Medicare, including Medicaid. Medicaid will offer telehealth benefits. You never go wrong by calling your insurance or looking online to check your benefits. But as far as I can tell, nearly every insurer has now embraced telehealth. So a lot of the legislative barriers that existed prior for the use of telehealth have gone away, and again, due to the pandemic. So if anything, the pandemic has really greased the wheels for telehealth to be a useful part of our of patients getting taken care of, and it's here to stay. I do not anticipate it's going to be just a flash in the pan. I think this will fundamentally change access for patients, and I think it's going to be a good thing. And right now, patients and physicians, at least in Illinois, only have about a month of experience with it. We're only going to get better at it. And there are many places that are developing protocols for how to do examinations through telehealth. And so I know that some of the orthopedic exams that we routinely do in the office that, are pretty much uniform from doctor to doctor. Likewise, with telehealth, we're going to start developing techniques to be able to diagnose more accurately problems that people have based on their telehealth exam. So again, right now, we're just at the beginning stages of using this as a tool. And like any tool, the first time you're using it, you may not use it as effectively. But with experience and with time, that tool just gets better and better.
Great. Can you tell me, how would someone find out which ortho health clinics are open right now? Where would they look to find that information?
So the ortho access clinics can be found on our Illinois Bone and Joint website. And the majority of our offices remained open, but because we've scaled back our availability, we've decreased the number of appointments for every doctor per hour to, again, abide by social distancing. We haven't had every office open. But if you need to find the ortho access locations, it's on our website, and the ones that are currently open are listed. You just search for ortho access on the website. For ortho health, for people who want to get involved in that program, that's usually through meeting your physician, which could again be done through telehealth. And it's a weight management program that we run through our physical therapy offices. It's not up and running It's not up and running as robustly now, simply because the pandemic has created bigger priorities. But it's certainly a service that we continue to offer and that would be available. But I think the question was about the ortho access clinics, and it's just on the website. And so if you have an injury and you need an evaluation, take a look there initially and then move forward.
And the website is IBJI.com, correct?
Yes, thank you. Yes, that's exactly what it is.
Great. That's all the questions that I see. I want to thank everyone for joining us today. Thank you so much, Dr. Chehab. This was wonderful and provided so much great information about, you addressed the questions that had been submitted on the early side, and you really addressed everything that, the people sent in with questions. So thank you so much for your time, for your expertise. It was wonderful.
Karen, thank you. Thank you very much.
All right. And I want to let everyone know, too, that Illinois Bone and Joint has another program on May 15th. Dr. Leon Benson at 3:30, that's a Friday, will be bringing his companion dog, their therapy dogs, and you can have some pet therapy in your home. So join us on May 15th at 3:30. Find us through the same place you found us now. And again, Dr. Chehab, thank you so much for doing our first virtual adult education series program with Illinois Bone and Joint Institute.
Thanks, Karen. for having me.
Take care.
Thanks, everybody.
Thank you, Eric.
Take care.